limit, man. Okay, calm down.
Tell us about Plan C and what Plan C does and how it's changed, if it has changed since this ruling.
Sure. So Plan C is an information campaign on abortion pills. It maintains a 50-state guide to abortion pills by mail and telehealth, plus a full range of FAQs and medical and legal hotlines, all in support of a safe, medically safe, self-managed abortion. And this is a concept that this country is very late to adapting. It's something that's been endorsed by the World Health Organization for years and years. It's something that when you zoom out and look at the global context, it's happening. Millions and millions of people are self-managing all around the world. And this medication, abortion pills are a combination of two medications, mifepristone and misoprostol. It's incredibly safe and effective. And from our campaign's perspective, it belongs in the hands of the people who need it. So we started this campaign about 6 years ago to share this information, really just to get the word out about what are abortion pills, how are people already accessing them, through the internet, by mail, and with or without telehealth in support of their own experience, in support of a safe, self-managed abortion. And we have also seen the growth of more and more resources to support them along the way. There's a medical hotline called the M+A Hotline. M+AHotline.org is a free medical hotline staffed by medical providers to answer anyone's questions along the way. And then the ReproLegalHelpline exists to answer their legal questions and address any sort of question around legal risk depending on their situation. So I want to just also honor and acknowledge, the conversation y'all are having. This is something massive just changed in our federal protections or in the ruling from SCOTUS and kind of a federal opinion. But this is a situation, as you know, that has been the case for a long time in this country. It's already been a real dividing line between who has abortion access and who does not. And even during the pandemic, we were already running our information campaign. We were already running a guide to what we knew to be available and what resources existed. And during the pandemic, we saw half the country come online with telehealth startups. And these are all providing a really wonderful supportive experience. They're at a relatively low cost. A lot of them offer sliding scale if someone can't afford it. It's all these organizations are female founded. They're all just, they saw the FDA roll back these restrictions during the pandemic and they just started coming online saying, we're doing this. And Plan C was very involved in sharing out information that we knew about what was possible, what was not, and working closely with medical providers who could, advise. It's really all from a public health perspective and a medical best practices perspective. But as we know, half of the country continued to not have mainstream access. And already in 90% of counties or more in the US, there is no abortion clinic. And already people are jumping through hoops. They're going above and beyond just to try to access this basic health care. So what just changed, besides the policy change, we see the country paying attention. And that's what's a real relief about this moment is the conversation that we all are having here and the points that you all are making. We're having them now, right? We're making these points where there's so much more work to be done. And all the points that you're making about what needs to be acknowledged with the policy side and with these politicians who we elected to protect our rights and to serve, obviously, major failures happening right now. And in the meantime, there's a phrase from the reproductive health, justice, and access community: abortions don't wait. And so in the meantime, we're making sure everyone understands that they still have options. And of course, it's complex. Of course, it's a quickly evolving landscape, and it's not ideal. Like what we are, why we exist, and how we center our information and ground our work is really that we're moving from a we're moving from a provider-centered experience, or maybe even a politician-centered experience, back to a patient-centered experience or an individual. What does that individual need? This is not only, as is being discussed on this conversation already, this has got to be a collective care issue. It's a collective need, and it's got to be treated as collective care. And also, it's got to center that individual and what they need and what they want to be their experience. And that's what's so hopeful about these resources that are aligning to ensure that the person gets what they need. And the truth is that people are seeking and needing different things, right? There is still a need for in-person care. And that's where these clinics still need our support. And that's where these funds still need our support, because all of them, not only have they been going above and beyond over the massive barriers that we've already talked about over the last decades, but now they're facing tremendous barriers, and they're still going to be trying to serve their communities. So we have to keep supporting them, and at the meantime, contribute to the equation, fill in the gaps with this information so that everyone understands what is self-managed abortion and where can you access this and what else do you need to know about your particular situation in order to make a decision that's best for you. So it's really a radical paradigm shift. And it really, I really feel like it speaks to the points that you all are making, which is like, there's a failure going on. The system is failing us. It always has in a lot of ways. It's always been broken in a lot of ways. It's just gotten a lot worse. And so now we're finding ways to take care of each other and take care of ourselves. And abortion pills can play a really powerful role in that.
How long do they last, by the way? Like, I actually mean like before they're stopped. How, and can like people buy them in bulk?
Good question. So one, we don't recommend like stocking up. We've been seeing that on social media, people, and that's happening with like emergency contraception and other medications. I know people are stocking up birth control. Doesn't seem like a good idea with abortion pills, and it's not really necessary. Like what we are seeing people doing is ordering advanced provision of pills, which is also a new development. There are activist organizations and medical providers, telehealth providers that are listed on the Plan C guide that are offering advanced provision of pills, and that basically means pills in advance of when you need them for your medicine cabinet, and those are good for, on average, about 2 years before they start to degrade.